Good afternoon, everyone. For those who don't know me, my name is Carrie Hules, and I am an outreach specialist with the Hope Chautauqua Coalition. For our second plenary, we will be asking questions to a group of experts who specialize in substance abuse and mental health. And our panelists today include Misty Pennington from Chautauqua County Department of Mental Hygiene, Ian Eastman from Evergreen Health, Steve Cobb from the Mental Health Association, Lori Reynolds from Prevention Works, Kelly Potter from Hope Chautauqua Coalition, Allison Espin from Chautauqua County Department of Health, Brady Dunick from BOCES, Cassandra Farrell from Family Services of the Chautauqua region, Alicia Snow from the Chautauqua Center, and Trish McLennan from UPMC, and Megan Schmidt from Brooks Hospital TLC, Carrie Rayner from Suicide Alliance, and Erica Lopez from the Outpour Project. And we have Carrie Toledo, I believe, also on here. I can't see the chat, but let me see. Yeah, she's a JCC student. So she is one of our panelists as well. Okay. So just a couple things before we get started. I will ask a series of questions, and anyone who wants to answer the question, if you can just raise your hand, or you can use the little reaction icon, and then I'll give a call on you, and you can answer the question as we go. Also, if there's any other questions from attendees, if you just want to put it in the little Q&A chat box at the bottom, we will get to them after we answer the questions that have been prepared. Okay. So our first question is, what support groups are available for those in recovery, and how can one find them? Allison Espin, I saw your hand go up first.
I guess now I'm confused. I don't have anything on the support groups.
It was Erica. It was Erica Care. Erica.
Oh, okay, I saw Allison's little reaction hand here. Sorry about that. Okay, Erica.
Hello.
Hi.
Here at the Outpour Project, we're doing a lot of programs with people in recovery, support groups. We also connect them with other people in the community that are offering. I know the Methodist Church here on Washington is also doing a program on Mondays. So the biggest goal, we're doing Clean, Sober, and Saved. We've been doing that for about 1.5 years, and that's every Thursday. And there's also programs out in Jamestown. We have a list here for people who are interested to connect with other organizations, as well as if they need counseling, if there's mental health issues, if it's just a need versus, you know, how to get their families back connected, because we have a lot of issues with children, and so there's just so much we can offer. The biggest thing I've been noticing that's working is connecting people with other people, because that's the biggest thing, that people don't know what's going on in our county. So I love what Prevention Works is doing, what Hope is doing with all these different connections. So that's pretty much where we are offering a class. So it's called Clean, Sober, and Saved. And that's through Darryl Strawberry. For those of you who know the baseball player, he actually put together this program, and it's a 12-step program, and it allows people to get certified at the end. They get a certificate to pretty much stay, and they could keep taking it over and over.
Excellent. Thank you, Erica. And I did see that Melanie had dropped the link to your Facebook for Outpour Project in the chat room. So if anybody wants to check that out, they can find the information there. Did anyone have anything to add to that as far as maybe something in the Southern Tier, Jamestown? Steve Cobb?
Yeah, hi. Thanks for calling on me. Here at the Mental Health Association, we have locations in Jamestown and Dunkirk, and we have wide variety of peer support groups to support people in recovery. Everything from very traditional groups like AA and NA. We have a Crystal Meth Anonymous group, which is a 12-step group that is new to Chautauqua County. We have that both available in person and through Zoom. So those are kind of the traditional recovery support groups, but we realize that a path to wellness doesn't just include 12-step recovery, although that's a huge part of it for many people. We have other options, meditation-based recovery, which is called refuge recovery or recovery dharma, and it uses Buddhist principles to develop wellness. We have knitting groups, and then we have groups that also focus on more on the mental health side, because we often know that many people looking for a path of recovery want to address both the substance use and the mental health side. So we have men's peer-led trauma groups, women's peer-led trauma groups. We have groups that focus on financial wellness too. And we have groups that focus on nutrition, reducing stressors. So those are just some of the groups that we provide, and you can access the schedule for all those groups on our website, which is mhachautauqua.org. Almost all of our groups allow Zoom participation also, so you can come in person or do it through Zoom.
Wonderful. That's a lot, long list. Okay, next question. In regards to harm reduction, what is harm reduction and the science behind it?
Hi.
Steve
Well,
Eastman.
yeah, I was waiting for that. Jumped the gun a little bit.
That's
Harm
okay, the
reduction-
icon's small.
Yeah, harm reduction is a set of practical public health strategies designed to reduce the harms of different high-risk behaviors without assuming abstinence from those behaviors. Some of the hallmarks of harm reduction is that it's culturally competent. Okay, it's designed to meet the needs of the communities that we serve. A lot of times you can have, efforts that fail because they don't take into account the people they're actually trying to serve and their very practical needs. Another hallmark of harm reduction is that they're low threshold services. Okay, we strive to make services that are very easy for a person to access and become involved in very quickly. So the idea of if a person would want an HIV test or a hepatitis C test, there really shouldn't be any barriers to that service happening and things. So we really strive to do a lot of walk-in types of services. Now, why is harm reduction important? Well, the Surgeon General says only about 1 out of 10 people diagnosed with a substance that meet the criteria, I should say, for a substance use disorder seek treatment. Okay, let that number sink in for a second. Only 1 out of 10. And we know that there's a lot of health impacts, right? So for that other 90% that's not involved. Traditionally, when we're serving people, we pay a lot of attention. I'm going to assume that people on this call are familiar with the stages of change model, so I'm not going to go into all of that. But we put a lot of attention into people that are in the action and maintenance phases of their recovery, okay? But we know, especially with this opioid epidemic right now, that people are dying and encouraging a lot of very serious, health consequences in the pre-contemplation phase and in the contemplation phase and the preparation phase. So harm reduction is a way that we make sure that everybody is being engaged in some sort of treatment. Now, here at the Exchange, when I meet a brand new patient, maybe they aren't ready to abstain from that behavior, but we know that some behaviors are more risky and some behaviors are less risky. And they're going to benefit from integrating some of these health strategies into their lives. One example from my program, we've been around now for 5.5 years. Right here in Chautauqua County, 769 people have come back to us and let us know that they've saved a life with a Narcan kit. That's 769 second chances that that people were able to experience because of that. Now, you asked about the science behind harm reduction, and the good news is you don't have to be a scientist to understand it, because most of us integrate aspects of harm reduction into our lives, whether we are a substance user or not. You know, when we drive our car, we put on a seatbelt. When we go out to the beach, we put on sunscreen. We don't just sit out life. There are things that we're going to experience, and we find ways to make those behaviors less risky. Now, on the science and data part about that I feel like I should answer because you asked it, is that the Centers for Disease Control has found that injection drug users that use syringe exchange programs, which is an example of harm reduction, are 5 times more likely to seek treatment than people that don't. There was a time here in New York State when injection drug users, we were having 54% of new HIV infections come through injection drug use. That was the year that syringe exchange was implemented in New York State. And today that number has dropped down below 3%. And we're also finding that there are some really effective impacts on hepatitis C. So that's a little bit about harm reduction and why it's important to the community.
Excellent. Thank you, Ian. Okay. Our next question is, can someone walk in a treatment provider facility and receive services immediately? And if not, how long does it take for someone to be seen after the initial call?
I could start with that, Carrie. This is Trish McLennan at UPMC Chautauqua.
Oh, hi, Trish.
Hi there. Here at UPMC Chautauqua, the answer is absolutely yes. A lot of different ways to do that. One of the ways is through our outpatient chemical dependency program over at the Jones campus. Monday through Friday, yes, it's during open business hours, but if someone walks in, they're not walking in to get an appointment scheduled, they're walking in to be seen. They will be seen by a counselor or nurse and assessed. If they need further immediate services, they'll be referred for those. In addition to that, and this is partly based on New York State regs, which I'm glad we're paying attention to this in New York State, but in our residential program, if someone is pregnant, an IV user, we pretty much are going to have an answer within just a few hours for a residential long-term program, which I've got to say, I also have a lot of connections in Pennsylvania, being UPMC, and that's unheard of. So I think some of the things we're doing in Chautauqua County are pretty innovative, pretty amazing. I mean, we're critics of ourselves often, and we often are saying it's not enough. But when we look at wait lists in other areas, it can be 2 or 3 months to get into a program. It can be 3 months to see a provider. We also, if someone comes through and needs a crisis appointment through our emergency department, they can see a provider within just a few days. We are working to do better MAT services so they can be linked up with Suboxone and then seen by a provider, have an appointment. And that's where, again, connecting folks like MHA so that they can help keep them safe and get the other needs met while they're waiting for those appointments. But the answer is yes. And the other answer is not enough, though. Still not enough. We want to say, yes, there's no wrong door. And Carol Wright's always been famous for saying that. But at the same time, we want to say, let's get more doors that open. So we are doing better than we used to do, and we still want to do better than that.
Thank you, Trish.
We actually also offer, pretty much anyone could come here. They could reach out to us on Facebook. We have we have pastors on staff that are willing to come out, meet with people. We can't get them in a facility, but we have even sent people out of state because they have a crisis and need to get out of here. We just recently had someone who had overdosed and had been Narcan, came back. He said, if I get back on the streets, I know I'm gonna die. We were able to send him out to a program in California. So we do have Christian homes that we're working with around in different locations that take people automatically. There's nothing they need to fill out. They qualify if they feel like they're in harm. So it's nothing here, but we have been able to send actually probably more than 10 people recently within Texas, California, Ohio. So there is out of states programs that take people a little quicker than our 28-day programs. But like I said, we're open to be able to get people in a crisis out of here as soon as we can to save their life. And we've had some successful cases that they're back home now with their families, and it's been successful. So we do offer that.
That's amazing, Erica. Sometimes people need to get away from here to really succeed in their recovery too.
Yes.
For us, in outpatient services, if anyone presents to a clinic while it's open, they will be seen immediately under a crisis appointment. That being said, every phone call that is made to our clinics for help, someone is offered an appointment within 72 hours at the latest. Through our 3-part assessment process, the appointment number 2 is held with our doctor. So if any medication assisted treatment is needed, it can be assessed at that time prior to full admission into treatment.
Thank you, Megan. Okay, next question is in the prevention effort. What can we as a community, school, or schools do to help youth avoid substance use issues?
I can speak as Lori Reynolds from Prevention Works. I really feel that the community and schools just truly need to be educated and having that awareness on what the most current trends are. For example, I just recently had a meeting where the teachers and staff didn't even know what dabbing is and the negative effects and what it can actually do to our youth. So if they don't know that information, then they don't know to make that referral to an outside agency or anything like that. And they don't realize that it is a high concentrated amount of THC that obviously can do a lot of negative effects with children. The other thing I feel is really important is for school districts to create policies around substance use. So if they get caught vaping, whether that be vaping marijuana or nicotine or any other drugs, then they should make a referral to another educational agency such as Prevention Works to work with them on providing them with education and changing their behaviors so that they're less apt to continue to use or at least to reduce their use. I'm personally on a nicotine annihilation team with quite a few people on here, the health department, Brady from BOCES and so on and so forth. And we created a template for schools so that they can use that template for their policies for schools, and not even just for their athletes, but for every child at the school. That way, you know, studies show that if you did that instead of OSS or ISS, then they'll be more apt to actually not use or, again, you know, reduce their use. So it's important to place policies in school districts so that students know it's not going to be tolerated here at the school. And then the other part of that for community and schools is just letting the community know the data and schools to know the data, which we do our Pride surveys and Clyde surveys through Hope Chautauqua. And that is something where we can show not only the schools and the parents, but also the children to know that most people don't use, kind of going that social norms approach so that they don't have to feel like they have to belong with the majority who actually don't use. And so we try to instill that data so they realize that most people their age do not use. And I also feel like one last piece, of course, I'm going to put this plug in, but I really believe in what we do with prevention is providing the evidence-based prevention programming so that school districts and the community really truly understand and learn the skills and tools so that they're less apt to use. We don't want to use scare tactics. We don't want to say if you smoke, you're going to die. Like that's something that's gone since DARE, you know, or something like that. So we want to make sure that we use and provide social emotional learning so the community and the school districts are better equipped so that they're less apt to not only use drug and alcohol, but obviously help with their mental and physical health as well.
Thank you, Lori.
Welcome.
Yeah, and
Anybody else?
to piggyback on that, obviously second a lot of what Lori said. Some of the things she hit on were things that I've jotted down on my notes to talk about too. So definitely like-minded on a lot of those things. But I think the overarching point, particularly from a school systems perspective, and we're at Erie 2 both season, and obviously more intimately involved in that than maybe some other areas, but you know, education, and more education. You know, that's the overarching theme, I think. You know, giving young people the tools to make the right decisions, to understand what consequences are for doing certain things, you know, and then also building that bridge of awareness with, you know, their parents and families and schools and youth. You know, that knowledge is power theme. You know, Lori hit on a lot of those points about sharing the data and bringing awareness and understanding to it. Incredibly important piece to it. I think another thing that schools might be able to do and reinforce is, you know, building healthy relationships, you know, creating that culture of care. You know, I don't know how many folks on the call are familiar with restorative practices or restorative justice, but, you know, tier 1 of a program like that is all about community building and healthy relationships and building those connections, not only among students, but among students and trusted adults to be able to, you know, navigate these challenging questions and situations, you know, really identifying those positive influences among peers and adults. You know, it's really about building that sense of community can really be a great way to tackle or potentially avoid these substance abuse things. Then obviously, you know, lastly, we always like to touch on social and emotional skills. So what can be done to foster those SEL skills from a young age, you know, in elementary school all the way through high school age. You know, Lori touched on some of the programs that Prevention Works offers in those areas that are great opportunities for schools to collaborate with experts in the region. You know, we see a lot of schools using Second Step to support SEL, Michigan Model for Health as a comprehensive health ed curriculum available to the majority of our school districts in the region that hits on SEL as well as a number of other health topics. Panorama Education is another service that's available that really elevates student voice in the SEL process in school districts. You know, that ability to be able to identify emotions and healthy coping mechanisms, all that good stuff kind of wraps together to, you know, cover not only substance abuse, but, you know, health issues in general. So I know we kind of took a little bit about outside of the substance abuse arena, but I think a lot of these things really overlap with mental health and physical health and social emotional health and all that good stuff. So I think all that kind of, you know, brings together a lot of those different points.
They do, Brady. I agree with that for sure. Callie.
I just wanted to add a little bit to that, like the community education piece. So, you know, there are a lot of resources in the community, and one of our main goals with the coalition is to reduce the availability of substances, you know, in the community, and to educate the families and the community about medication safety, safe use, safe storage, and safe disposal. So I think that it's been a great collaborative effort that we've had with prevention, treatment, and recovery, because we do have the accessibility. For instance, you know, we do know that with COVID, we had a lot of kids that were home. So they had accessibility not just to, you know, alcohol, they were vaping, they potentially marijuana, and pills. Getting into their parents', you know, medicine cabinets. So I'm probably going to jump ahead a little bit, but we do have resources available in the community. We have 12 permanent drop box location sites throughout the county. For Hope Chautauqua, we have the ability for individuals to reach out to Hope Chautauqua, you know, call one of our, either our Dunkirk or Jamestown office, visit our website or our Facebook or Instagram page, because we do have the opportunity for individuals to dispose of pills, tabs, medications, liquids, and patches safely within their homes. So we do have that, as well as we have storage bags, so locked storage bags. So we have a lot of people that are on medicines, and though we've had there's been some questions about that with the storage bags or storage boxes. If individuals, well, they could break the storage box or plastic or cut into the bag, but at the end of the day, if you're locking it up, it's just not out there. It's not visible. We talk about, accessibility and availability with alcohol. Some of the things that happened during COVID that were recognized by many of us, not just in prevention, I'm sure treatment, recovery, mental health, was on social media. There was a lot of advertisement. A lot of adults were advertising, it's 5 o'clock, let's drink, or smoking, or vaping, and so on and so forth. And we do have a lot of youth that are on social media, and they see that, and so they think that that's normal, or they think that that's acceptable. So really for us, it's just getting that information out there to let individuals know that it is important to practice medication safety, safe use, safe storage, and safe disposal. And like I said, I'll put in the chat box our phone number, website, whatever, because we do have free resources available to the community.
Thank you, Kelly. A lot of information between those three. All right, Cassie has something to share with us.
There. I'm Cassie Farrell. I work for Family Service, and I'm a school social worker in Jamestown. So I do a lot of individual counseling with the kiddos. And I agree with what everyone's saying. But I think another piece of the puzzle is looking at the underlying causes of addiction, and often like the trauma. And another thing I think we can do with the schools is increase our kiddos' connections in the community, to their church, to the Boys and Girls Club, to the Y. And also, I think we need more of creating a better environment between the staff and the parents in the community, improving those relationships. And I think a piece of that is working with other community partners. It's been tough this year because we don't have the after-school programs. There's not a lot of stuff for kids to do. They're at home. So that's why what Kelly mentioned with keeping stuff locked up in a way is very important, but the kids like live and breathe this stuff. I'm at Love Elementary, and I really do a harm reduction approach, but I think another piece is really improving our communities and putting more in our communities for our kiddos to support our families, and utilizing the programs we have and bringing those connections to the school. That's what I talk to all my kids about. Let's talk about Boy Scouts. Let's talk about Girl Scouts. Let's talk about church. Let's talk about a sport. Give them something else as a replacement. And then working with the families and the communities, because I think that's another piece. We have to go upriver. If we're just dealing with downriver stuff, it can be a little futile. So really working from the ground up to improve our communities is something that I think needs to happen more. And there's great work being done, for sure. Look at everybody on this call. But it's hard.
Yeah, I agree, Cassie. Okay, on to the next question. This is geared more towards behavioral health. How do I find a therapist? Cassie?
So the agency I work for, Family Service of the Chautauqua region, we do individual counseling, couples counseling, we can do family work. So calling our office directly is something you can refer to your clients to. I also know CCMH, Department of Mental Hygiene, has a lot of providers. Call them directly. The Resource Center, the Chautauqua Center, all do counseling. I think I got them all.
Oh yeah, we got a lot of those on here. Excellent. So how do you talk to your children about substance use?
I can take that one from Prevention Works. One of the main websites that we like to refer parents to is Talk to Prevent, talk and then the number 2 to prevent. It's a really good resource, and it really helps you make sure you understand that the messages that you send your kids can affect, you know, their behaviors and their choices. Having conversations as early as possible. For example, you see an advertisement on TV about alcohol, like the Corona and the beach and things like that, and they try to set the stage of that if you drink, you'll have fun, and that's the only way to have fun. But realistically, you can say, do you think that's what really happens, or do you think that possibly that they may be throwing up on the beach, or passing out or drowning because they're not making good decisions because alcohol lowers their inhibitions? And, you know, you can kind of take any reality and make it into a learning lesson as things go on. Another piece that you can do is, again, using scare tactics. I think that you have to be as real as possible with kids and having that conversation. And try to make sure that you provide or link them to a place that can provide ways to, like we were saying, Cassie was saying, it's more of the core of trauma or not having the skills or tools so that they can resist. I think coping with negative emotions is one of the biggest factors of use and escaping or using or, you know, things like that. And so we want to make sure we teach them how to manage their emotions, such as like we're having this hope and healing, what Trish was talking about with mindfulness and meditation and things like that. So that way it actually sticks versus just providing those scare tactics. Another piece that is good, you know, to kind of add to what Kelly was saying with medication safety is, you know, you being the role model as the parent. So don't put your alcohol right by the milk carton. You know, kind of hide that away. Accessibility is one of the #1 reasons for use for youth. Another thing is vaping. If you just leave your vaping out, it's kind of the norm for them to see it and they just touch it and we don't know what's in that vaping device. And so I think also is adult perception. So as the parent, if you feel that, you know, marijuana is safe, there's no issues, well, guess what? That's what your child's going to go to too. That will be their perception, and the chances of them using marijuana at a young age is much higher. So we just want to make sure that as parents, we talk to them as young as possible, even when they're young, like 3-year-olds. You know, that's not candy, that's a medication. Medication is a drug, and that's not safe for our body, and obviously an age appropriate manner. And to make sure that we talk about, okay, this looks like juice, it's a glass of wine, you know, talking about quickly how the brain is affected by alcohol, obviously in a most age appropriate way. I'm just throwing different ideas out there that you can talk to children as young as more than you think. And that's what I would definitely suggest, is going to Talk to Prevent is a very, very good website and a very good tool to help parents talk to their kids, and just being open and honest, and having that wall down so that you're all on the same page as the parent and as the child, to make sure they know your rules and what you expect of them, and vice versa. What does a child want from their parent, and so on and so forth. So I think it's important to have that rapport and that relationship so that they come to the parent and ask those questions.
Thank you, Lori. And I believe the links were put into the chat for a few options about talking to your children or other youth about substance use. Okay, next question. Where can someone detox?
I could certainly start that conversation. Although we don't have a licensed detox unit at UPMC Chautauqua, any Article 28 hospital, so in other words, any New York State hospital, is permitted to do withdrawal management. There is a myth out there that it has to be on a detox unit. It does not. What it needs to do is meet medical necessity. So people who are admitted to hospitals like UPMC Chautauqua on our med-surg floor or an ICU would have something going on with withdrawal that made it medically necessary for admission. We've done lots of conversation over the last couple of years, and part of it was based on our CNO, who went to an amazing conference in Rochester and learned more about the downsides and the harm of trying to do detox for people with opiate use disorder. That actually the research shows more people end up AMA, meaning leaving against medical advice, end up overdosing, and your risk for death goes up. Because what should be happening, rather than, I'm looking at all of these faces here, we should be not trying to detox folks with an opiate use disorder, but help them with mat services. And that's what is successful. So placing someone on a detox unit to get them off of opiates is not always a safe or smart way to go. But definitely with alcohol use disorder or with a other substance use disorder that needs withdrawal management because of their coexisting medical concerns, and again, I'm going to mention a woman who's pregnant, if the risk is going to be higher for some medical complications. So there might need to be a couple days in a hospital. But that is definitely one option. I know most of us are familiar with Bradford too, that does some withdrawal management, ECMC does. But then the other piece is a lot of us, and again, looking around the room, looking at Megan and others who, many of our outpatient practices can do some level of ambulatory. And again, that's a assessment you'd want with a provider to see if it's appropriate for that person. Is it going to be safe for that person? Or what kind of risk is it at? Some of our physicians, we do have some physicians with UPMC under the medical providers that do some lower risk withdrawal management from alcohol. And that may be the best way so that a person doesn't need to leave work, doesn't need to leave their home setting, and they may be more likely to stay engaged if they can do it that way. So those are a couple things, and I'm sure others may have some thoughts on this call as well.
The Terrence House, it's Horizon, and that's actually what I've been using. It has a 28-day detox. They're usually pretty good at getting people in within a day or two when beds are available. So usually if I get people to call early in the morning, they can get in there. It's a 28-day program for the detox, and then they also can stay long-term, which they have other homes that we have someone in there right now he's been there for 6 months. So that's another more local. It's in Buffalo. It's on Elm Street. I'll go ahead and share that and the number. But that's what I've been successful with using.
Thank you. Okay.
I think if I could, Carrie, just to kind of tack onto that, in addition to detox, and Erica, you're doing a great job of mentioning some other things that may go with it. There's the medical detox, but then I think, as you mentioned, detox usually isn't 28 days, so we'd couple with the treatment on top of that. There are a number of us, and we're one of those programs that have, we don't like to market as a 28-day program anymore because that's not necessarily what a person needs, but our average length of stay is between 19 and 28 days in our inpatient chemical dependency unit. And then some folks go right into residential, which is long-term. That may be anywhere from 90 days, it may be a year. And again, that's individualized. So a person may stay on our acute inpatient substance abuse unit for 2 weeks, and then they may transfer over to residential if that's a better fit. And they meet that level of care. So I think what's neat, and again, I'm saying this from just watching and getting to know folks and doing a lot of collaboration with folks, is that we're getting better as providers in our region at matching services to individuals rather than the old cookie cutter. I mean, I started out in the field in the early 90s, and this is what you do. It's a 28-day program. You're not allowed to go to it unless you, quote unquote, failed treatment. I think many of us have that phrase. And now best practices, and which means what's best for a person who's trying to get help is that you see what they need. You don't have to fail treatment, meaning you don't have to mess up and deal with the shame or the guilt of missing outpatient appointments to go to an inpatient unit. You may just go straight to an inpatient unit if that's where the needs are. So I think that's the thing that we all need to keep looking at and keep challenging ourselves at, is what's actually best for that person. Is it one that's more pure 28-day? Is it a men's program? Is it a women's? There's several residential in our Western New York. So matching it to the person and matching it to the resources would be great. Thank you for letting me share that too.
Thank you, Trish. Okay, next question. How are peers being used in recovery initiative. Stephen Cobb.
Thanks, Gary. Some of the initiatives that we have going at the Mental Health Association incorporate both a perspective from recovery, but also harm reduction too, because those two, especially in early recovery, go often hand in hand. We have an OD mapping program with the county where we respond to overdoses that come through the 911 system to connect the person who is overdosed and also family members to recovery support services and treatment services should they want that. That's one. Another recovery initiative that we're a part of and is happening here in Chautauqua County is called the Strong Starts Chautauqua program, which is directly responding to the high rate of prenatal substance exposure that is a fact of life here in Chautauqua County. So we actually have peers that are being connected with moms and dads at whatever point of contact they have with us to support them and get them connected with recovery services and treatment services, or perhaps harm reduction services, with the goal of strengthening the family and strengthening the wellness of the family and providing parents who are attempting to move forward in dealing with substance use to all those services that they need. So those can be medical services or connection for work or the possibility of work, connection to housing. So we're really able to take a holistic look with the peers in order to support the moms. And then one of the other programs at the MHA that we have is called the OPEN program, which is the Occupational Peer Empowerment Network. And that is a goal where we have specifically trained peers that work to get people who are in recovery back into the workforce to give them the supports that they need. And we're also able to work with businesses to help provide them with the supports that they need to support any employees who might have be dealing with substance use issues. So those are some areas of with some new initiatives and one not too old initiative that we have going on at the MHA.
Erica, yes.
One of the things we call it accountability buddies, and they're pretty much what they do is they have a peer, someone who helps them, and pretty much they got to stay in contact, they got to stay accountable to who their surroundings are. They have to call in at least once a day. So it's kind of something like that, and it's usually we do that a lot with families. Many women that are also in domestic violence, trying to help them. They've set some goals on where they want to be, and it helps them to have that peer, that accountability buddy that we call, that keeps them accountable, and they can reach out, and it's not judgmental. It's just, hey, we want to, tell me what you're feeling. I want to go back, or I feel like I want to use, and it's just been very successful, and mainly with a lot of our younger families that are in their early 20s. I'm seeing that that's very important for them to constantly, they didn't have that parental guidance. They didn't have that support system growing up. So if they don't have a peer, or they don't have someone that they can constantly be in contact with, they usually do relapse pretty quickly. So that's what we're kind of working with. It's just kind of a peer accountability buddy.
Hey, that works. Almost like a sponsor, an AA too. My next question, Stephen Cobb kind of touched base on, but it was what are some of the harm reduction initiatives happening in Chautauqua? So I didn't know if anybody else had anything to share off of Stephen's list. Ian Eastman, I see your hand up.
Yeah, well, I think wherever you see people coming together in the county to really reduce wait times and make it easier for people to get their health needs met in a timely fashion and with compassion, I think that's where you see harm reduction efforts happening. I think a great example of that we haven't mentioned yet is the Chautauqua substance abuse and the acronym just went out of my head. The Chautauqua Substance Abuse Response Partnership. There it is. That's the thing when you get into this kind of work, you don't realize that a lot of your brain's going to be taken up with these acronyms and you forget what they stand for. But one of the neat things with CSARP is there's something magic that happens when you get everybody in the room together. Prevention, harm reduction, peers, treatment. A lot of life, is about coping and adapting, okay? And that's no different for people using substances. And because people have different needs and different ways they're trying to cope and adapt, there's not one organization that can do it all. But by getting everybody working together, it's amazing what we're learning about each other and how we're facilitating ways that we can work together, for the benefit of people. An example recently that comes to mind is, we've really had a terrible spike in overdoses over the last few months. And one of the ways that CSARP is responding is they purchase fentanyl testing strips. So people that are using substances can actually test their substances to tell if there's the presence of fentanyl in that. And Evergreen's been providing, strips for a few years now, and we have some experience with that. So we were able to share some of our experiences with other organizations. So we met with Mental Hygiene. We're going to be meeting with TLC here soon, Mental Health Association. We just met with Resource Center yesterday. Not just to walk them through, the technical aspects of using a strip, but to talk to them about what we've been learning about helping patients strategize to prevent overdoses. So those are some of the exciting things when we're working together. The other thing that I would be amiss if I didn't mention it was also about the availability of Narcan in the community. It's really, really important to have that. The other day we had a patient we hadn't seen in a very long time come into the exchange. She had overdosed in the past, and she came into the exchange to let us know that she's graduating and to show us that she has a really great career path planned out. Things in her life are going really well. And, she would have never had a chance to get there if somebody hadn't saved her life with a kit. You can come to the exchange. We're here at 320 Prather Avenue, weekdays between 10 and 4. Take 10 minutes. We can have a little conversation. We can train you, provide you with a kit. There's other organizations that do that. I think Allison Espin is one of the panelists here today, and I know she's done a lot of great trainings on behalf of Chautauqua County as well. She's done a lot of good group work here. In the chat box, I'm just putting 2 other initiatives that I think that are important for people to know about. Number one is a program called NCAP. Okay, because if when you need it, you need it. In pharmacies, by and large, there's a lot of pharmacies that are open 24 hours a day. And NCAP is something that if a person has health insurance and they present to a pharmacy, there are some numbers that the pharmacist can put in that probably are going to reduce that person's copay to 0. So they should be able to get a kit. The other thing is a lot of people aren't aware that you can text for Narcan as well. In Erie County Health Department is kind of a regional hub for some of the overdose prevention. And you can actually call that number or text it, and they will mail you a kit. And it'll arrive in 2 or 3 days, and the instructions are there on the internet. So So those are some other initiatives that I think are real important to know about harm reduction in the community.
Thank you, Ian. Excellent information. Okay, next question. What suicide resources are available in the community? Carrie Rayner.
Thanks, Carrie. Here at the Suicide Prevention Alliance, we provide evidence-based mental health and suicide prevention trainings to community groups, businesses, church groups, schools, and universities in Chautauqua County here. We have support groups out there for lost survivors. There's also a support group for folks suffering with suicidal ideation. And the best resource that I could point anyone to is our website, preventsuicidechq.com. On our website, first thing right on the front page is I'm in a crisis. Click on the link and you get instructions on what you need to do if you are in immediate crisis right now. You could learn on our website about warning signs of suicide, risk factors of suicide. We also have all of our events and our training calendar listed on there. We have our local and national resources. And a nice thing that we also included on the website was information for reporting on suicide for the media. Because the way that we talk about suicide is really important. That's all I have.
Thank you very much, Carrie. All right. Next question. Is vaping really that bad? Oh, Cassie, I saw your hand up, so I didn't know if you had.
Oh, I was just going to piggyback on the suicide prevention also. The county has some great resources in place, and I just wanted to put in a plug for Sources of Strength. It's a school-based program that really improves the community in a school and brings kids together. So I think the schools that have implemented it, it's evidence-based and run by the students, and it's really beautiful and it's very effective.
Yeah, if you could just put that information inside the chat box on what it's called, and that way everybody can see it, that would be wonderful. I'll repeat my second question in case you guys didn't hear it. Is vaping really that bad?
I can talk on behalf of vaping. I'm going to actually get Ken Dahlgren ready, though, if you are ready, Ken. There you are, Ken. Actually, take it away, Ken.
Well, I guess what your definition of bad is. I mean, you can jump off a 50-foot bridge or you can jump off a 20-foot bridge, but you're probably going to have some negative results. I look at it from the point of view of vaping and young people. And I think the important thing to remember that we often miss is the fact that the vast majority of vaping products contain nicotine. And nicotine and the adolescent brain are not friends. You know, a young person, nicotine is often their first addictive substance that basically trains the brain and prepares it towards a future that may lead to other addictions. You know, we don't like to talk about that a lot, but it happens. It's the reality. And I think a lot of parents have this idea that vaping is, you know, a safer alternative. Well, it's probably true from a cancer point of view, but from the point of nicotine addiction, no. And from the point of lung issues, no, because you're still breathing in the fine particulate matter deep into your lungs, even though it may not be carcinogenic. And in many cases, there are carcinogens, but even if it wasn't, you're still setting yourself up for emphysema, for bronchitis, for respiratory issues. And we know with young people, respiratory issues can be a real issue, and for older people as well. I mean, leading to COPD and other things like that. The science is still, you know, out there. And obviously we did have the outbreak of EVALI, which complicated things, the lung disease. And they found that due to a certain substance, most cases of vaping or most cases of EVALI were due to this substance, this vitamin E acetate being in it, but not all. There's still a fairly high percentage of people who used vaping products without the vitamin E acetate that still develop Diwali symptoms. And I don't think most people realize that either. I think it sort of got swept under the rug. So that's just my 2 cents on it. Obviously, any foreign substance you're bringing into your lungs is not something your body naturally wants there, and needs to be taken into consideration. And obviously, with vaping, it's evolved into widespread use of other substances besides nicotine and the flavors that are being vaped. So, it's definitely crossed over into a lot of other addiction issues.
Thank you, Ken. I do have just like 4 minutes left, so I wanted to answer some of the questions in the chat box really quick. Support for families. I'm looking for Q&A forum rather than a coaching program. Any insight on where I can find this? So anybody, if there's more of a coaching type of program for like families, support for families, I guess, in regards to substance use. Cassie, is your hand up from before? Or, okay. Erica, did you have?
Well, we have spiritual life coaching, which helps people with soul healing, inner healing, just toxic things that have happened as a child. And so that's one of the big things we do, walking them through life and having them see their identity and what their worth is, versus just so the life coaching that we offer is a spiritual life coaching through the love of Jesus Christ, that they find healing, they find wholeness, and they begin to hope for a better future, no looking back. So that's breaking addictive soul ties, all kind of different programs that we offer through that. But it's a life coaching class for families. Also, we've done it with more elderly people that have had a lot of hurt and now they're raising their grandchildren. We're seeing a lot of that. So we're doing some life coaching with that as well.
Thank you, Erica. I have another question. If someone needs to renew their youth mental health first aid training, where can they do that?
I have and Carrie can jump in on this too. I know that Erie Dubosi's is collaborating with a number of our community agencies on offering some youth mental health first aid trainings and research. I have a PDF that I could share into the chat too. I know they're doing a blended format with part of a work through on your own and then a part of it meeting together in group. But that is a couple members of my team. That's not me specifically. So I'll make sure I get that in the chat, but and Carrie too, if I missed anything, I know you might have hit something there too, but I will put that in the chat.
Yeah, we have trainings going on throughout the whole summer through August. There's 2 trainings being held in the county every month through the summer. And I know that we're looking to move that into the fall, winter as well.
Thank you. Thank you, Brady and Carrie. And also in the chat, it states that Prevention Works also provides opportunities for children living in a chemically dependent home. They also work with families for information and referral resources. So you can just reach out to them on their website at www.preventionworks.us. And there's phone numbers, and Brady added some information to the chat as well. I do have just 1 minute left, so I'd like to thank everybody. And if you have any questions, I know there's a couple extra in the chat room here that we can privately answer, so that way we can get those answered for you, okay? Thank you to our panelists, and thank you for the attendees' questions, and we'll get back to those other questions after our break. Thank you.